Hello, hello friends. Let us now learn some important points about the barium meal. Barium meal is a radiological study. In this, we are going to learn about in barium meal we are going to study the anatomy and pathology of diseases related to esophagus, stomach, duodenum, and proximal jejunum. Barium meal is a radiological study of esophagus, stomach, and duodenum and proximal jejunum. In barium meal, similar to barium swallow, we use contrast media, that is barium sulfate. Here, orally, we administer the patient barium sulfate as contrast media for doing this barium meal. Now, first we will see the indications of barium meal. In indications of barium meal, when the patient has certain symptoms, like when the patient has some clinical features or symptoms like epigastric pain. If the patient presents with any type of epigastric pain, which is actually suggestive of peptic ulceration, because peptic ulcers can be diagnosed with barium swallow. And also when the patient presents with anorexia, weight loss, vomiting, heartburns, dyspepsia. If patient has any of these symptoms, then we can try to do a barium swallow to find out the reason of these symptoms. If the patient presents with any upper abdominal mass, and if you suspect this upper abdominal mass is arising either through esophagus or stomach or duodenum or ileum, then we can do a barium swallow. Or if the patient has any gastrointestinal hemorrhage, or if the patient presents with either gastric or duodenal obstructions, any type of obstructions which can be easily diagnosed with barium meal, gastric or duodenal obstructions. Then, if the patient presents with any type of malignancies like gastroesophageal disease malignancies, so any type of malignancies, cancers or tumors of esophagogastric junction, or any malignancies of stomach or duodenal cancers, small intestinal cancers, especially which are in jejunum. So all these can be diagnosed with the help of barium meal. Then we can also use barium meal for diagnosing diseases like tuberculosis, which is affecting the GIT. GI tuberculosis can be diagnosed by this barium meal. And some motility disorders of GIT can also be diagnosed with the help of barium meal, like achalasia cardia or diffuse esophageal spasm or achalasia cardia. These can also be diagnosed with the help of barium meal. Then this barium meal can also be used in children. In children, we can use this barium meal to diagnose the cause of vomiting. If the child presents with vomiting, then to diagnose the cause of vomiting, then we can use the barium meal. So that the cause of vomiting in a child can be due to gastroesophageal reflux, or it can be due to some pyloric obstruction like pyloric stenosis or anything, any type of pyloric obstruction, or it can be due to malrotation of the gut. So all these can be diagnosed with the help of barium meal. Now, what about the contraindications of barium meal? So main important contraindications of barium meal is conditions where barium should not be used. So barium should not be used if there is any perforation. So here, because we are testing the stomach and duodenum, So if there is any history of gastroduodenal perforations, then barium is not used, because perforations, because what happens in this perforation is that if this is the stomach and duodenum, and if there is a perforation here, now the contents which are present here in the stomach will reach the peritoneum. So the contents which are present in the stomach, they come out and they enter the peritoneum. Now, obviously, because we are using barium as a contrast agent for barium meal, we give certain amount of barium to the patient. So this barium in the stomach, it will reach the peritoneum, and when the barium reaches the peritoneum, it will irritate the peritoneum, and some of it, the barium is also absorbed into the blood system, and once it reaches the CNS, it can result in encephalopathy. So because of this, all these complications, barium is not used whenever there is any type of perforation. So here in barium meal, if there is suspected cases of gastroduodenal perforation, we do not use barium. Similarly, if there is any history or suspicion of, if the patient has history or suspicion of aspiration, then obviously we should not use this barium meal, because in aspiration also barium will reach the lungs. In aspiration, the barium will reach the lungs and through the trachea. So at this time again it results in inflammatory reaction of the lungs. So it is not recommended. Any types of obstruction, like especially large bowel obstruction, we should not use barium, because if there is obstruction, barium gets precipitated after some time and it forms inspission. So we do not use this barium if there is any type of large bowel obstruction, or if there is any fistulous communications of the bowel. Obviously, the reason for this is also similar to that of perforation, where in fistulous communication with any other organs, this barium will reach the other organs and also cause inflammatory reaction. If it reaches the peritoneum, or if it gets absorbed in any type, in any region, this barium can reach the central nervous system and result in encephalopathy. So because of all these causes, barium is contraindicated. And if there is any history of recent biopsy, if there is any history of recent biopsy from GIT or barium granuloma, if the patient has any if history of recent biopsy, then also barium is contraindicated. Why? The main reason for this is that barium will reach the biopsy site. Okay, and at the biopsy site, this barium will cause an inflammatory reaction and result in formation of granuloma. So as a result, this barium is also contraindicated in case of recent biopsy. So these are the important indications, contraindications of barium meal. Thank you.